personalized medicine, or precision medicine. Personalized medicine is aimed at identifying specific treatments or interventions based on the unique characteristics of an individual or their disease. For example, all cancer treatments have risks and side effects. The goal of personalized medicine is to achieve the best results, reduce risks and side effects, and avoid unnecessary treatments. Personalized medicine takes into account information such as a person's genes, non-genetic personal characteristics such as lifestyle factors like alcohol consumption, disease characteristics such as hormone receptors or genes involved in the development of a tumor. Examples of targeted breast cancer treatment include the following. If your tumor is HER2 positive, your treatment plan is usually tailored to include trastuzumab, Herceptin, which has been shown to reduce the risk of recurrence of HER2 positive breast cancers. The positive or negative status of the tumor's hormone receptors, estrogen and progesterone, is used to make decisions about hormonal therapy. For example, tamoxifen, Nolvadex, is a hormone therapy drug used to treat early and advanced breast cancer that are hormone receptor positive. These breast cancers need estrogen to grow. Tamoxifen stops or slows the growth of these tumors by stopping estrogen from binding to the hormone receptors on the cancer cells. The genetic profiling of tumors, for example, using Oncotype DX or MammaPrint, looks at certain genes in the breast tumor to adjust treatments and to predict the risk of recurrence when cancer comes back, or metastasis when cancer spreads to other organs. A tumor profile test does not give genetic information about the person. Rather, it gives information about the genes in the cancer cells. PARP inhibitors may help chemotherapy better eliminate cancer cells in people carrying a pathogenic variant in the BRCA1 or BRCA2 genes, or when a pathogenic variant of one of these genes is found in the tumor. Olaparib, Lynparza, is an example of a PARP inhibitor used to treat metastatic breast cancer and other cancers associated with the BRCA1 and BRCA2 genes. Pharmacogenomics is the study of how a person's genes affect their response to drugs. It helps predict which drugs may offer the greatest benefit and which may have the greatest risk of side effects. For example, pharmacogenomic testing is available for 5-fluorouracil, also called 5-FU, and capecitabine, Xeloda, which are chemotherapies used for certain cancers, including breast cancer. In some people, the standard dose is toxic because they have genetic variants that prevent them from eliminating the drug normally. Here are some options currently being studied. Polygenic risk scores. Current recommendations for breast cancer screening are based primarily on age. Therefore, recommendations are essentially the same for all women. Polygenic risk scores make it possible to individualize the risk and offer screening recommendations based on that risk. This test combines hundreds of elements of genetic information with other risk factors, notably family history of cancer and lifestyle habits. With a personalized assessment of cancer risk, it is possible to estimate in which risk category a woman falls, propose screening measures adapted to each risk category. For example, a woman with an increased risk could start annual mammograms at a younger age. In short, this model helps to better target screening for those with a higher risk and avoids unnecessary screening for those at a lower risk. Liquid biopsy. Liquid biopsy is a test that measures the levels of tumor DNA or tumor cells circulating in the blood. For the time being, these tests are not used to diagnose cancer. Liquid biopsy is being studied to help predict recurrence, survival, and predicting response to treatment in people with cancer.